My name is Clay with Physical Therapy. We also have Alex with Physical Therapy.
Hi.
You may recognize us from your therapy in the hospital. We're here to go over hip precautions. These continue even as you discharge home. Alex is going to be our demonstration. He's the individual that has just had surgery. So hip precautions, one of the biggest ones is bending over, sometimes bending too far forward when you're in a seated position, recliner, wherever you're at home. Be very careful, cautious not to bend too far forward, say down to your ankles to tie your shoe, scratch your ankle, anything like that. That also works in the reverse. If somebody wants to tie their shoe but they bring their leg up to their chest, either way you're still bending too far, you're putting too much strain on the back of the hip, so we got to be very careful with those motions. That leads us right into number 2, when you twist or turn the leg inward. This happens more often when somebody's standing with a walker. If you change position and pivot on that leg or twist, we should have asked Alex to do that in seated position as well. If you're sitting down, same thing. We picture somebody bending over from a seated position to pick something up behind them or beside them. And finally, crossing your legs. Okay, this happens and it puts too much strain on the outside of the hip. So if you're laying down, standing, sitting, any position you're in where you're crossing your legs at the feet, ankles, any of those positions, if you are reclined or laying on your side and you cross your legs, again, it puts strain on the outside of the hip. So you got to be careful. Don't bend over too far forward. Don't cross your legs, and avoid twisting, aggressive twisting motions at the hips, lower leg. All right, we're back again. We have Alex laying down this time to review hip precautions, some of the what not to do versus safe movements. Laying down in this supine position, this is acceptable, but as soon as he goes to actually cross his legs, it puts strain on the outside of the hip. That is one of the hip precautions. We've got to avoid that movement. Same thing getting out of bed or out of a laying down position. If he starts to sit up, he's got to be careful not to bend too far forward. So he's got to stay kind of reclined back. Leaning back is a safer movement. As he brings his legs off the side of the bed, he keeps his legs apart. He doesn't want to twist or cross his legs. Stays reclined back. And then as he stands, he's got to use his legs. He can keep his surgical leg kicked out. He can stay leaning back, use his upper body, and push up. And of course, if you do have a very low, Alex is tall, if you have a low, soft couch, that might not be the safest position to be in because you're seated so low. So avoid low chairs in general. Final topic, how long do we follow hip precautions, or what can I do to, again, help myself avoid these things? If you find yourself in a very low seated position, sometimes it just simply means you ask for help. Avoid the rocking type movements. That does, again, place additional strain on the hip. Someone else can come over, they can help you stand, come to a rising position, just a safer option. And you do have to keep in mind or consider that you are going to follow your hip precautions for 3 months. That sounds like a long time, but that is a very safe, effective way to continue your rehab course without complications.